A look at the new Obama administration HIV/AIDS policy that the administration says is the first comprehensive plan in U.S. government history. Back in 1995, 44% of Americans said HIV and AIDS was a number one leading health concern. Well, what about today? Let's take a look at the number. You see the huge difference. Only 6% of Americans now identify HIV/AIDS as the biggest health problem facing the United States. A dramatic change over those 15 years. Now, what about today? What is AIDS in America today? 56,000 HIV infections every year. Minorities are at greater risk. 1.1 million Americans have HIV. About 500,000 have developed into the full AIDS virus. About 20% are unaware they carry the HIV infection, and 30% with HIV get no care. One of the things the administration is trying to address today. So what is the president's plan and the goals? Reduce infection rates, number one. Increase access to care. Reduce HIV-related disparities in the healthcare system, increase abstinence education, make condoms and needles, clean needles, more available, and increase HIV testing. As the president was outlining this new policy today at the White House, he was briefly interrupted by a heckler. Take a listen.
To support our new direction, we're investing $30 million in new money, and I've committed to working with Congress to make sure these investments continue in the future. The second... hold on. You can talk to me after. We'll be able to talk after I speak. That's why I invited you here, right? So you don't have to yell. Right? Thank you.
Spending levels is one source of disagreement. Even though this policy was widely praised by the HIV/AIDS community and the healthcare community today, there is some dispute about whether there's enough money in the plan. Excuse me for turning my back for 1 sec, but let's take a closer look at that. In the 2011 administration budget, about $14 billion goes to care and treatment of people with HIV/AIDS. About $6.7 billion is spent overseas on global efforts to fight the disease. $2.6 billion of the money goes for cash and housing assistance, just shy of $1 billion for prevention, just shy of $1 billion for research, and some other costs as well as we go forward. What about the scope of the disease in the United States? The darker the state, the higher the HIV infection rate. As you notice, most of this is the larger the state, and the East Coast here, the larger states down in Florida, Illinois, the bigger the state, it tends to be follow through with a higher infection rate. Who are the people impacted here? No surprise if you've studied this issue before, about 44%, disproportionate amount among black African Americans, 35% of those with HIV or white, 19% are Hispanic or Latino. The administration announcing this new policy today, again, it widely being praised. The one question in the HIV/AIDS community, will the president and will the Congress follow up with the money, not only this year, in the years to come, an important issue to keep an eye on.